Hello everyone, this video is about rabies. Rabies is also known as hydrophobia, that is, fear of water. It is a highly vital viral disease that causes inflammation of brain in humans and other mammals. The virus is usually spread to people from the saliva of infected animals. 75% of the infection is spread through bite and other through scratches and ticks from infected animals. Causes. It is caused by Lyssa virus, genus of family Rhabdoviridae. The animals that can spread rabies includes dogs, monkeys, bats, and fox. There are three phases in humans when the virus enters into a body. The first phase is the prodromal phase. When the virus enters into a nervous system, our immune system tries to fight back, causing flu-like symptoms. The nerve might damage and causes prickling, pain, numbness where you were bitten. This lasts for 2 to 4 days. The second phase is the excitation phase. The infected person will be hyperactive. The third is the paralytic phase. The muscles gradually become paralyzed, starting from the wound site, and a coma stage slowly develops and eventually death occurs. Pathophysiology. When the virus enters into human body through saliva of animals from a bite, the virus catches the nerves and it spread to the brain through nerves. The virus multiplies rapidly in the brain and causes inflammation in brain and spinal cord. When it becomes severe, results in coma and finally death occurs. Symptoms. Incubation period. When the virus enters into the body, it usually takes 1 week to 1 month for a person to develop rabies symptoms. The initial onset of rabies begins with flu-like symptoms include fever, muscle numbness, tickling or prickling, burning sensation at wound site. As the virus continues to attack CNS, there are two different types of disease that can develop. The first one is the furious rabies. Infected person will be hyperactive and excitable. Other symptoms include insomnia, confusion, anxiety, hallucination, excess salivation from the mouth, and fear of water, that is hydrophobia. The second is the paralytic rabies. Infected person slowly become paralyzed, will slip into coma, and eventually death occurs. Diagnosis. Specimens like saliva, skin biopsy, hair follicle, and blood and brain are taken. Laboratory tests include FAT, that is fluorescent antibody test, most widely used for postmortem rabies diagnosis to detect rabies virus antigen. The third is the Nigri body examination. Cut a small piece of brain and place on a glass slide, stain it with cellular stain and examine for the availability of Nigri bodies. Treatment. There is no specific treatment. Management of wound. Animal bite area is washed with soap initially. The second one is the post exposure treatment. If a person is bitten by an animal, he or she should receive rabies vaccine of 4 doses in 14 days. One shot of vaccine should be given as soon as possible after the bite, and the next 3 doses should be given on the 3rd, 7th, and the 14th day. Anti-rabies vaccines are available in India. Human diploid cell vaccine HDCV, purified vero cell rabies vaccine PVRV, purified chick embryo cell vaccine PCECV. If possible, isolate the person in a quiet room Protect as far as possible from external stimuli to prevent spasms. And the most important thing is observe the animal that bite the person for 10 days and notice if there is any change in their behavior and excessive salivation from the mouth. Thank you. Have a nice day.